All right. This talk is on the importance of testosterone. This is a very controversial topic, so it's one that I'm really excited to talk about because part of my mission is to dispel some of the beliefs about the harms of testosterone, but also give you enough information, hopefully by the end of this, that you can make an informed decision about whether or not testosterone is right for you. Just a little background on me. So I'm Dr. Nicole Peoples. I'm a board certified physician in internal medicine. I've been a hospitalist for over 15 years, but my passion is in helping women stay healthy for longer. So I trained in something called functional medicine, which addresses root cause illness, but I also focus specifically in on hormones and longevity. And my biggest credential is that I'm a woman in perimenopause. And I say that because it doesn't matter how much training I've had, it wasn't until I hit around 40 that I was able to really identify with a lot of the things that I'm going to talk about today in a way that was real and allowed me to see what my patients have been suffering from throughout their life. So I'm going to actually blow up this video here so you guys can see more of it and less of me as we go through it. All right, so I like to start off with talking about what is testosterone, because if you look at the definition, it always says it's a male hormone. And I think that's part of the reason why there's so much confusion, is because we focus on testosterone as being a male hormone as opposed to a natural occurring sex hormone that is found in both men and women. I literally had to piecemeal a definition together for this because anywhere you look, all it's going to say is that it's a male hormone. And this is part of the reason why so many women don't feel like testosterone is something they should be taking. And it's to the degree that it's just a generalized hormone for both men and women, that we fail to recognize that women have more testosterone than we actually have estrogen in our bodies. We just have less testosterone than men. So it's this idea that testosterone is a male hormone when it is vital to a woman's well-being as well. And so that's really important to understand as we go through this. It's also the most active hormone in women, so it does a lot for us. It's not just there for our sex drive and our sex drive alone. It works all throughout the body, in the brain, in the heart, in the breast, in the ovaries. It has actions everywhere. So understanding that about hormones in general is going to be really important when you think about why one might consider taking hormone replacement. Now, the thing about hormones is that it peaks, or testosterone, it peaks in your 20s, and then it starts this steady decline over time. So well before people even get into menopause or even perimenopause, we start to see a decline in our testosterone levels. And this can result in symptoms, as you'll see in just a moment. So one of the things that I really want to harp on, even though we've just gone over what testosterone is, I want to make sure that everyone is aware that testosterone is not the only hormone. And it's important to understand that hormones work in concert. They're like a symphony. You mess with one, the other ones are also going to respond. And so we do have other hormones like estrogen, which is the hormone that we most think about when we think about hormones in women. But estrogen interacts with another hormone called progesterone, and that interacts with testosterone. That interacts with cortisol and thyroid hormone and insulin. And so as a practitioner, one of the things that's really important for me to think about in my patients is how are all these hormones playing together. So it's important that we don't get stuck on just one hormone at a time, because I am going to paint this sort of rosy picture about testosterone today, and you're going to walk away wondering why aren't all women on a testosterone replacement? But I want you to know that it's not just about the testosterone, it's about how these hormones interact together. So what exactly does testosterone do in women? So it helps with sexual function. And that's where we get a lot of the hoopla when we talk about testosterone. As a matter of fact, it is approved by the Menopause Society for sexual dysfunction. And that's what a lot of doctors will focus on. So if you go to your doctor and you ask them for testosterone for sexual dysfunction, they will likely say, if they know better, and we'll talk about some doctors who may not know better, they'll say yes. But if you go to them and say, I want testosterone for my bone health, my muscle health, my mood, my energy, my memory, cognition, heart, metabolic health, then they may say no. And I'll explain to you why that is the case, but it's been studied and shown that testosterone affects all of these things. And like I said, testosterone works on just about every cell in the body. So it has actions everywhere, and it does affect all of these areas. So what are the symptoms of low testosterone? So when our testosterone, like I stated in the beginning, your testosterone peaks in the 20s and in your 20s, and it starts to decrease over time. And some of the symptoms that you may experience that are associated with low testosterone are things that you probably are well familiar with in your own life, but nobody ever said, oh, testosterone might be the cause of that. We call low testosterone androgen insufficiency, just so that you have the right terminology. But some of these symptoms may be loss of energy, fatigue, loss of mental clarity or focus, loss of muscle mass, weight gain, decreased exercise tolerance, increased recovery or decreased recovery from exercise, anxiety and depression, irritability, moodiness, insomnia, decreased general well-being, and decreased libido or hypoactive sexual desire disorder, which is low libido or low sex drive. Now, I put that one at the very bottom because that one I think is a pretty no-brainer. Most people will agree that testosterone helps with low libido or low sex drive. But all of these other things are symptoms that I'm sure that many of you who are on this call because you're experiencing some of these other symptoms and didn't know up until this point that testosterone or low testosterone in a woman can cause this. So I'll also say that these are the same symptoms that you might see in a man with low testosterone. So you'll see that it interchangeable, and we don't talk enough about men. I am going to do a whole webinar on testosterone in men, but these are the same symptoms. So what the actions of testosterone in men are no different than the actions of testosterone in women. So the fact that as a clinical or a medical community, we say it's good to give testosterone to men, but we don't think it's good for women, seems a little ridiculous because we deserve these benefits as well. And just as a reminder, if at any point you guys have questions, please put them in the chat and I'm more than happy to make sure I answer them. Back to androgen insufficiency, a couple of things you should know about that. It can occur at any age. So this is a really important one because oftentimes when I talk about perimenopausal and menopausal care, the idea is that you have to be at a certain age to actually qualify for hormone replacement. And for testosterone, even for younger women, there may be scenarios where testosterone replacement might be beneficial for a 30-year-old, maybe even a 20-year-old, given the right circumstances. Normal levels are not established. And I'm going to come back to this idea of normal levels because you'll go to your doctor and they'll say, everything looks normal. And that has a connotation that in most patients, you think, oh, everything is normal, then nothing is wrong. But that doesn't always pan out. So we'll talk a little bit about what that means. And part of what it means is that there's a poor correlation between the symptoms that you might be having and your testosterone levels. So essentially, I can have one testosterone level, you can have a totally different one, and mine can be lower than yours, but you have more symptoms. And that just has to do with a lot of the confounding factors that are happening in your body that make you more or less responsive to testosterone. And so if you don't understand, and you don't necessarily have to understand, but if your doctor doesn't understand the interplay of how your testosterone interacts with not only all the other hormones in your body, but also some of the other chemical factors like proteins, then they may not understand why your testosterone level may look normal. I'm putting air quotes, you guys can't see me, but they may look normal, but you still feel like crap. And that gets to this point that I make next, which is many factors can affect the effect that hormones have on your body. So if you have, for example, too high of a certain protein in your body may not recognize that testosterone. Or if your receptors aren't sensitive, then your body may have a lot of testosterone in your system, but your body's not responding. So there's a lot of things that as a clinician, you've got to be able to think about when treating patients. And this is one of the reasons why a lot of doctors may not understand why you might have normal levels, but not responding well. So it really comes down to signs and symptoms. So my personal experience with testosterone is that a lot of the symptoms I was personally experiencing, things like anxiety or depression, mental fog, brain fog, word finding issues, all of these symptoms that I was experiencing, I was trying to find an answer that didn't include testosterone and couldn't find one. So I would be labeled as being depressed and be put on a medication for depression. I might be considered for a medication for anxiety, when in fact, the low testosterone was driving or is the root cause of these symptoms that I'm having. And so now that I know that, then the obvious answer would be to treat my testosterone and not give me a bunch of pills that I don't particularly need. And the great thing about testosterone is that your symptoms respond. So it's not just enough to say your levels are normal, we're going to give you some testosterone. If women weren't having a benefit, if they weren't having their symptoms be relieved, then nobody would want to be on it. But what I find, and even for doctors who are my patients, many of them who were never taught about testosterone and may have had their own biases about testosterone, once they get on it, they're like, wow, the symptoms that I was having are now relieved. I wonder why I didn't learn this. And the sad part about this, and one of the reasons why I do these seminars, is because 10% of women actually seek medical advice. So the majority of women aren't even going to the doctor saying, I'm having fatigue, I'm having brain fog. We're just assuming that this is a natural part of aging and there's nothing we can do about it. So there's no need to talk to our doctors. So again, some of the benefits. So what are these symptom relieving factors? So yes, we know that testosterone acts everywhere in the body, but if you take testosterone, what are some of the benefits of that? So increasing lean muscle mass, we're going to talk about how this is not the same as being bodybuilding and getting a masculine physique, but we do lose the muscle mass as we get older. And so maintaining that lean muscle mass is really important. Decreasing fat mass. So this has to do with your body composition. It's not necessarily that testosterone is a weight loss drug. It is not. But as you build more muscle mass, your body will burn more fat. Increasing energy and vitality, stamina and motivation. This is huge for both men and women, particularly as we go through menopause and andropause is how we describe testosterone decreasing in men, that this is a time when people get burnt out. They lose their desire and their stamina to keep up. Improves neurocognition, so that brain fog that I was referring to, mood and overall sense of well-being. This is actually a very well-studied one. It's not, what's so interesting to me about this, it's not that the studies don't show that testosterone improves your mood, but what the medical societies say is that it's not approved for that purpose. Meaning we can give, even though we know testosterone will improve your mood, we don't approve doctors giving testosterone to improve your mood. Again, we'll come back to this a little bit later. Decreasing anxiety and depression. Because the medications for anxiety, depression are some of the most prescribed medications, it would seem that we would be looking for actual root causes of this, particularly if you've never had depression before. If you find that you've gotten into your 40s and you're like, I have a newfound friend in depression and anxiety, you really have to think about your hormones. Pain. So testosterone actually alters your pain perceptions in a positive way. So again, what are some of the most common prescribed medications in medicine? Opiates, pain control. And if you can treat pain without having to use opiates, things like Percocet and these really hard-hitting pain medications, then testosterone would be a great alternative to that. So cholesterol, the heart, so high blood pressure. So testosterone is actually protective to the heart. So a lot of people believe that testosterone will actually cause blood clots and will cause damage to the heart. I'll talk about why that is not the case and what we're confusing that with. But in fact, testosterone has a positive effect on the heart, as well as the bone, the breast. As a matter of fact, there are some studies where people use testosterone to treat breast cancer. And then I put it at the end because this is the one that everybody will agree on. It improves your libido. But even though everybody agrees upon this, I don't know that women are running to their doctor saying, hey, my sex drive is low. It's ruining my marriage. Can you put me on something? Most women don't even know that's an option. And so I think it's really important that women know that they have options here. So getting to that question, so why doesn't my doctor prescribe testosterone? You go and they say everything looks normal. I think someone in the chat also made that reference that they went to their doctor and they said that everything looked great. So here are this is what I believe is the reason. Number one is training. So when I was in medical school, I never learned about testosterone use in women. And even to this day, medical students are not learning about testosterone in women. So the reason why your doctor doesn't prescribe it is because they were not trained. And there's an assumption with a lot of physicians that if they didn't teach me this in medical school, then it must not be a real thing. And a lot of doctors aren't taking the time to go read the new literature or read the old literature for that matter on this topic. And so it's really important that you go to a physician who is up to date, who is going to conferences, who is reading these journals, because there's continuing education that is needed before you can start prescribing these hormones, particularly if you did not learn. Limitations in studying testosterone in women. So there are studies about testosterone in women, but there is a big gender gap there because we frequently talk about testosterone as being a male hormone and dismissing the idea that it has an effect in women. We don't choose to study it. And so it's important that we start to pay attention to a lot of the new studies now that women are saying, no, we want to take testosterone. We see that there's a benefit. So more data is going to come out on that. The other issue with this is that, and this is just a historical issue, women have been disregarded in medical care for a long time. And if you don't trust that when women tell you, I have brain fog, I think I'm developing Alzheimer's, early dementia, I am more fatigued than I ever have been, and I am sad or depressed, and I've never been depressed before. I lack motivation. If you hear women say this over and over again, but you dismiss it, then obviously you're not going to study it. So it is something that has to change in the culture of medicine. But there are some other limitations that I think are important. Because of the limited studies, we also have a lack of standardization. So a lot of doctors don't feel comfortable prescribing medications that they don't understand the right dosing or how to track it. And this is something that has even changed in my personal practice because I was trained in hormones from 3 different entities, and each of them had a different way of practicing. And ultimately, I settled on treating the patient, treating women, and figuring out what helps them feel the best, and taking the information that is out there about testosterone and developing a protocol that works for my patients. And you'll find that many doctors do it differently. And the good thing about testosterone is that the risk to testosterone is very low. And I'll explain in just a moment what those risks are, but the risks are actually quite low. So having doctors do it their own way, which doctors do a lot for a lot of different conditions. So this is not outside of the standard or norm for doctors to treat how they're used to treating or what works for their patients. But that lack of standardization does make doctors a little bit weary. And so the other really big issue is that there are no FDA approved options for women. So there are FDA approved testosterone for men, but none for women. So this is another reason why your doctor may not want to prescribe it, because they don't want to use a compounding pharmacy. And I'm not going to talk about compounding pharmacies here, but the doctors who are prescribing from compounding pharmacies typically have found the compounding pharmacies that they love and that they trust. And many of these compounding pharmacies have very high standards, and most doctors just don't know that. The other thing is that lab tests don't correlate with symptoms. We talked a little bit about that. Professional society recommendations, I also talked about that, stating that a lot of the recommendations only approve testosterone, and this is even funnier. They approve testosterone for sexual dysfunction, but then they say that there are no approved FDA drugs or testosterone for women. So then they say you can use compounding for sexual desire, but they also in the same time say don't use compounding pharmacy. So there's a big conflict. So you can imagine right now in the medical community, there is a lot of turmoil between what they're saying and what you can actually do, and then contradictions even in that. So I say that to say, these are a ton of reasons why you may go to your doctor and they may say, no, I'm not going to prescribe testosterone. So it is incumbent upon you to find doctors who are knowledgeable and willing to do so. The other big thing, and I'm going to touch on this in a second, but testosterone is not the same thing as synthetic anabolic steroids. So most people, when they think about testosterone, they think about the bodybuilder. And I have a whole slide on this, so I'll jump this for now. And then there's also some questions about how you give it. So do you give it via injection? Do you put it on versus a cream? Do you use a pellet? I have a whole entire lecture coming up on pellet therapy, but I will touch upon it at the end. And then the last one, which I also already alluded to, is do we believe women? If you start off the conversation with something, telling your physician that you're having these symptoms and they don't believe you, they're not going to treat you. And so that I think is really important. So a couple of really important things that I want you to know when you walk away from here is that a lot of people say, I want my hormones tested. Uh-oh, I see. They may say, I want my hormones tested, and they will go to their doctor and their doctor will say, everything is normal. And there's a couple of reasons why. The first thing I'll have to say is that with all labs, when we look at any lab, there is something that is reported on the lab sleep that says your reference range. A reference range has nothing to do with your optimal levels. It just says if we test a population of people, this is where we see their levels lie. But it doesn't say whether those people were having depression, anxiety, were they overweight, did they have heart disease, did they have any of the issues that you were complaining of, and they also had an abnormal or a suboptimal lab norm level. So understanding that was one big part. Number two is knowing the test to order. You should know that if you're going to get your testosterone checked, you want to make sure they get a free testosterone. As I was preparing for this talk, I was going onto YouTube and looking online and seeing what the lay person was saying about testosterone, and even some doctors. And a lot of them were talking about total testosterone. That just lets me know that they don't understand testosterone if they're only going to speak in terms of total. And a lot of doctors will only test a total testosterone. So it's important for you to know when you ask your doctor, can you test a free testosterone on me? All right, so I said I was going to come back to this, and this is really important because I think this is what most people are afraid of. They are afraid that testosterone is the same thing as the synthetic anabolic steroids that people use for weightlifting, and it is not. So synthetic steroid or anabolic steroids are usually a synthetic version of testosterone that is enhanced for muscle growth. So they've actually changed the compound so that it favors its anabolic or its muscle growing capacity and less of the testosterone itself. And they also use super physiologic doses. So doses that average women should not take. And this can be very subjective, but just know, because there's even amongst physicians, the dosing that people will provide are going to vary. But the doses that you get from a medical supervised physician who has been trained in how to prescribe testosterone, you will not have these side effects. You will not have the masculinization that you might see in a person who's using illegal anabolic steroids. So it's important that, obviously, I don't think anybody here is interested on going on Amazon and purchasing their steroids. You're going to go to a doctor who knows what they're doing. But here's the thing that you should know is that there are side effects to anabolic steroids, some really serious ones. Some of them do overlap with taking testosterone, and I'll point that out to you in just a second. But things like aggression and losing hair, or cardiovascular or heart issues, organ damage, these sorts of things, when you take super physiologic anabolic steroids, can absolutely be side effects. The problem is there's not a class effect. It's not just because these steroids cause this problem that means that testosterone is also going to cause these problems. But the problem with our medical literature is that there's an overlap, and people make the assumption that one hormone is going to do the same thing as another. We see that when we talk about estrogen and progesterone as well, but we also see it with testosterone. I see you guys' questions. I'm almost done, and then I will get to your questions, I promise. And then, so what are some of the potential side effects, right? So for a lot of women who are like, I'm absolutely not going to take testosterone, I'm scared, what are the possible things that can happen? Acne is absolutely something that can happen, but keep in mind, all of the side effects that I'm about to describe are all reversible. So part of the acne, there's treatment. If you do develop acne as a result of being on testosterone, there are things that we can do to mitigate and we can also adjust dose. It's not something that will be permanent when you're working with a practitioner. So fluid retention, clitoral enlargement. So the enlargement of the clitoris can happen. It is actually quite rare. But if it does happen, we reduce the dose or we change the dose. The voice changes. This is also something that you might see, and what people are scared of is that their voice octave goes down. And really the way that my instructor was saying is that if you're a professional singer, this minor change in your voice octave can become an issue. But for most people, they won't recognize it. And if in the event that you do notice a change in your voice, again, we can adjust the dose. And then there's the idea of hair loss and hair growth. So as a matter of fact, testosterone will increase your hair growth, but oftentimes it increases it in places you don't want it. So like your chin or on your chest where men would normally develop hair. But it can also increase hair on your head. This side effect is also very much malleable. There are a lot of things we can do about it. Remember, I told you guys at the beginning, all of your hormones play together. So it's important that whenever you talk to your doctor and whenever you get your labs, that they're not just testing your testosterone, but they're also testing other things that are important, like your iron levels, your ferritin levels, your thyroid levels. And so if you're not checking all of these things and you're not aware of how to manage all of your body as one unit and not just one thing, then yes, you may have some side effects that may be exacerbated by testosterone if the other things aren't balanced. So it's important to have balance and to work with doctors who understand that. So to the question, I've got a minute left. I'm going to go over a little bit, so I hope you guys will be a little bit patient. But should you consider testosterone replacement? And my answer is always it's individual. The first thing you want to know is, what are your goals? This is probably the most important. Do you have symptoms? If you have symptoms, and testosterone will solve that problem, instead of you going on a ton of other medications, a blood pressure medicine, a cholesterol medicine, a sleeping agent, and antidepressant, anti-anxiety, then absolutely you might want to try testosterone. But when we talk about your goals, remember I also said that testosterone can be heart protective, it's bone protective. So even if you're not having symptoms, the question of whether or not you need to be on testosterone so that you can age gracefully is also, I think, important. For me, I will be on testosterone. I'm not on estrogen yet because I'm not menopausal, but I am on progesterone. But I will be on these medications because my body needs it to stay healthy. So again, really talking with your doctor about what your goals are going to be important. Then what are your safety concerns? So if you're a person who, if you got acne, it would ruin your life and you don't have time to readjust doses and stuff like that, you may say, you know what? I don't think testosterone is right for me. Or you may start at a really low dose and work your way up, knowing it may take you longer to get an effect, but it also prevents side effects. So just being clear about that, but also making sure that your fears are not based in things that aren't true. Do you have a comprehensive approach? And this is the part that I conflict with on a lot of practitioners who prescribe hormones. As a functional medicine doctor, I'm always talking about all the things. How's your gut? How are all of your hormones doing? What are your nutrients looking like? Are you eating good? I want to know all of these things in addition to giving you hormones. So it's important to be able to have a balanced approach. Also, who's prescribing? So a lot of people will just go to their OBGYN or their primary care doctor, which is fine if they have been trained. But if they have not been trained and they're just winging it, you may not get the results that you're looking for. Just be aware of that. And then, do you feel comfortable? If you don't feel comfortable with anything that I said, if I have not convinced you that testosterone is the right thing for you, then it's not the right thing for you. It is a personal decision. So dispelling some of the common myths, again, just to help you get your mind clear of some of the things you may have heard. Again, testosterone is the most abundant biologically active female hormone. It is a female hormone, in addition to a male hormone. Men just have more testosterone. It's essential for physical and mental health. So it is there for your bones, it's there for your muscles. These things you naturally lose over time, and it's an essential part of that process. And so if you're interested in maintaining all of that, you need testosterone. It is not masculizing. You will not look like a bodybuilder. It would be very hard to have a 40, 50, 60-year-old woman get on testosterone and look like a bodybuilder. We just need some basic muscles, right? We need to keep the muscles that we have, and we need to build a couple of extra muscles and keep our bone strength. It can absolutely increase scalp hair growth. And if you do have some hair loss, the question is, what else is going on? There are so many other things that cause hair loss in women that sometimes we just need to get to the root of that. It is cardioprotective. If you have heart disease, the testosterone will actually protect the myocardium or the heart. Take the type of testosterone you take. The type of testosterone you take, whether it's given through an injection or a cream or through a pellet, matters. If you take it orally, you will have adverse effects. And so they're like liver and clotting issues. So knowing which form to take is important. It is mood stabilizing. It's not going to cause excessive aggression. It is breast protective. And so particularly women who may not want to take estrogen because of breast issues, testosterone is a really great option, even though I have a whole other talk on whether or not estrogen in fact causes breast cancer, which it does not. Spoiler alert. Studies on testosterone in women are increasing, and as they increase and education gets better, you'll find that more people are going to be willing to prescribe it. Just so that as a wrap up, I just want to tell you a little bit about what I do. So my name is Dr. Nicole Peoples. I am a board certified physician in internal medicine. I am a partner in a practice called Path Health, and we prescribe hormone replacement therapy as well as a medical weight loss as GLP-1s. We also do IM nutrition. So if you're interested, if you live in Atlanta, then Path Health you might want to consider for your hormone treatment or for your weight loss. And so just so you know how to get in contact with us or how to get more information, you can go to our website, choose mypath.health /CYP, and you can book your consultation there. We have monthly pop-ups. We have one tomorrow. So if you guys are interested in coming, there's going to be a QR code you can scan on the next slide or one of the slides. And then you can follow us on social media. I'm everywhere at Dr. Nicole Peoples. That's on LinkedIn, Instagram, Facebook, YouTube. You can get started with us for $199. We get testing. We will review your results, and we will decide which path is the best one for you and put you on a comprehensive program. I'm doing a talk for this series for the next month. So today was Should Women Take Testosterone? But next Tuesday, I'll be talking about does hormones cause cancer? The week after that, should my husband be on testosterone? I did allude to that earlier. And what you should know about pellet therapy. I do pellet therapy in my practice. I'm a strong believer in pellet practice, and pellet therapy. Pellet is just a way of prescribing hormones. And so I want to help dispel some of those ideas about hormones as well. So here's the QR code. I'm going to leave that up. I'm going to come back on screen. And you guys can scan that QR code. This is our address if you'd like to come by. So let me see. So for those of us who had a hysterectomy before menopause, how do you explain the timing of menopause? This is a great question. And so this question can be interpreted in two separate ways. So one is, I had a hysterectomy. How do I know if I'm in menopause? That's one way. So the answer to that is we do check labs. We specifically look at something called an FSH, but we also look at symptoms. So if you've had a hysterectomy, you're no longer bleeding because you don't have a uterus, then you just need to work with your doctor in identifying when the right time is for you to start hormones. And then, thank you. Thank you.
Kimberly Britt, she is asking that she recently had a lab panel done for hormones, and they said, quote unquote, they're all normal. She hasn't had a cycle in 10 months and can't sleep due to night sweats. So she's trying to understand what the normal is. And I know you explained that normal versus optimal. And if you can explain the definition of menopause and in terms of the duration of not having a cycle for her.
Let me answer that. So if you, okay, so your labs are normal, right? The problem here is this, is that everybody is going to have a different response to their specific hormone level. So for example, if when I was 20, my testosterone level was 45, and now at 40, my testosterone level is 20, I may feel that shift between 40 and 20. That's one thing, right? So if you at 20, your testosterone level was 20, and now it's 15, you may not notice that shift. And so it's going to be different for all of us. It's not just hormones that behave like this. This is a lot of different labs that behave like this, that it is variable from person to person. So that's number one. And being in that normal reference range, again, does not account for the fact that for decades, we weren't making reference ranges based off of women and what their symptoms were, because we weren't even acknowledging that those symptoms were real. So I really think that the reference range for testosterone is spurious. It doesn't really mean anything. However, there are certain conditions where elevated testosterone levels may mean something. So things like PCOS. So I think you really have to understand how to interpret it. And if your doctor doesn't understand that, they'll say everything is normal and not have anything else to say after that. And then the idea that you're having problems with your cycles, you are having night sweats, to me, we know that's what happens when your hormones decrease. And we know that we can control that by giving you hormone replacement therapies. So in my mind, there's no reason to only solely base whether you get on hormones based off of labs. So I would take into account all of that. Menopause, by definition, is going 12 months without a menstrual cycle. That is, again, if you have a uterus, you might know that. But if you've had a hysterectomy or an ablation, then you will do what I just said earlier, which is look at the whole picture, look at your symptoms. So for you, I definitely think that you would benefit from hormone replacement therapy. Whether or not you're a good candidate, we can get on a call and talk about that, or you can make an appointment and we can talk about that. All right, sorry, Dr. Anna, what's your next one?
Okay, so the next one from Ebony, she's asking, how long does it take to see positive effects? And you talked about she's asking, how do you identify an optimal dose?
Okay, it varies. Again, everything in medicine, whether or not your doctor has been treating you this way or not, everything is personalized. It doesn't matter if I'm putting you on high blood pressure or if I am treating your migraines. What works for one person is not always going to work for the other. And this is very normal in medicine. It is no different when it comes to hormones. So if I put you on a cream, you may respond immediately, or it may take you up to 3 months to see a response. It takes about 60 to 90 days for your hormones to balance. And if you remember in the beginning, I said all of your hormones work like a playground and they all kind of work together. And so they're all going to bounce off of each other, and you may not get a nice steady state until 3 months of being on a hormone if you are using creams. If you decide to get a pellet, you may see that onset a little bit faster. I usually say within 2 weeks, honestly. And then you hit that steady state in about 4 to 6 weeks, and you stay there until your pellet starts to wean off. So again, the dose matters, you matter, your body composition matters, where you place it matters, what your diet is, what your gut looks like. A lot of things will affect it. But the long and short answer is that you will typically see an effect within the first 2 weeks. And I always tell people, give it time. If you tried hormone therapy and you're like, I'm 6 weeks in and I don't see a difference, it may be that we need to adjust your dose, but it may be that your body is just taking longer for you to see a response. And then how do you identify the optimal dose? So in our practice, we do something called a menopausal rating scale. You will give us subjectively what your experience is. So you'll say, my sleep is, I'll rate it on a scale of 1 to 4, 4 being horrible, 1 being great, 0 being nothing. So when you start, you might be at a 4 with your sleep. And then after about 6 weeks, you might be at a 2. And so then my goal is to get you to a 0. So the optimal dose will adjust until we get you to where we want to be, unless that dose is too high for you and you start to have side effects. So it is going to be a little bit of a dance, but the optimal dose is not based off of the lab. It is based off of your symptoms and your side effects.
All right. And just scrolling, Kimberly Britt, she is vouching for reputable compound pharmacies, saying that she finds them to be beneficial and affordable compared to some FDA medications. She does indicate that her total testosterone was checked in that quote unquote normal range, but not her free testosterone. So I think that just reiterates your point that you need to go to a physician or provider who knows what they're doing, knows what they're checking for, in addition to coupling that with who you are as an individual and as a patient. Rashida asked, why is the period so heavy during menopause? Or I'm assuming she means more perimenopause, because when you're in menopause, by definition, ladies, that means you've not had a period at all for 12 months in order to even get into the definition of menopause. But in the perimenopause state, I believe she's asking, why can periods be so heavy?
So that there's lots of answers for that. But in essence, we do know that everybody's cycles will vary during perimenopause. When they start to vary is going to be dependent upon you. And not everybody's periods are heavy during perimenopause. A lot of people's menstrual cycles decrease. Some people's menstrual cycles get closer together. So there are a lot of changes that can happen. But if you have heavy periods, the number one thing for you to do is to rule out some other causes, right? So fibroids are a big thing that can cause heavy periods. Endometriosis can cause a lot of pain. And why am I forgetting and progesterone insufficiency. Progesterone decreases also during perimenopause, and there can be an imbalance between your estrogen and your progesterone. This is what we call balancing your hormones. We're really balancing your estrogen and progesterone. And so we often see heavy bleeding in women who don't have enough or not producing enough progesterone. There are lots of reasons why a cycle may get heavier. Again, this is a great opportunity for you to talk with a knowledgeable physician and figure out what might be the cause in you.
And I'm going to add to that, even though we clarified the definition of perimenopause versus menopause, ladies, if you are in menopause and have any atypical bleeding, it is very important that you get consultation with a gynecologist to get an ultrasound to look at your endometrium. We don't want to miss things like uterine cancer and other things along those lines. You may need a biopsy, a DNC. I'm not saying that's the first thing to think about, but as physicians, we need to think about that. And oftentimes, if someone has not had heavy periods or they're tapering off, and then you start something different, whether it's any type of hormone peptide medication, and then there's a significant change in your cycle, that same type of evaluation would also be recommended, because you just don't want to blow it off as, oh, it's just my crazy hormones or something like that. And especially in the menopausal period if you have any atypical bleeding. She comes in, she's asking, do you recommend testing over a time period rather than just a single point in time due to these fluctuations?
So not for testosterone. You can test testosterone at any point in time. I used to, and occasionally in my premenopausal women, sometimes in my perimenopausal women, I usually would like to test their estrogen and progesterone during a very specific window. And that is about 7 days from your ovulation. But it can become very difficult for women to do that. I found that women, if you are on top of your cycles and you know exactly when you ovulate, or you know how many days your cycles are and they're regular, then getting your cycle, your labs during this very specific window can be very helpful. So I don't do it anymore. And like I said in the very beginning, how I view testing has changed drastically in the last couple of years. And the reason is that at the end of the day, although I like to see your numbers and that plays a piece, that plays a role in how I decide what I'm doing, it now for me plays a smaller role. Your symptoms play a bigger role. Your sort of overall picture plays a bigger role. So I'm not as strict on telling people you have to get your hormones tested at this very specific time, just because it's labor intensive. But if you're willing to do it, then we can use that information even more specifically.
Okay. And then we have, looks like there's a name, iPhone 218. Is it Charlsetta? If I'm mispronouncing that, I do apologize.
That's
She has had,
correct.
okay, she has had pellet therapy in the past, states it was magical. She felt normal again. However, her issue was that the levels dropped so quickly, oftentimes before that 3-month window. She says she was tested,
Oh, you cut out.
which reduced her hormones and burning through them more quickly. Oh, I cut off. Can you hear me?
I can hear
Hello?
you now. Sorry.
Okay. So
Yeah,
she
I
said
hear you.
that she had her cortisol levels checked and they remained high. And she was told that it's reducing her hormones and burning through them more quickly. Can you offer, I'm assuming, more insight on this issue?
Yeah. Yeah, there's a lot here because we're talking about testosterone, we're talking about cortisol. And again, all of the hormones play together. So understanding how to balance all of those is going to be important. One of the reasons why you may still have very high levels, but you may not, or I'm sorry, you still having symptoms is because the protein, I alluded to it, just the term of that protein is called SHBH, is sex hormone binding globulin, can actually increase with certain medications, it can increase with the certain eating patterns, it can increase with certain supplements, and that will bind up your free testosterone. And so you may end up having less of a response to the testosterone that's in your system. So you have all this testosterone floating around, but it's bound up and it can't actually act where it needs to act. Another thing is that some of your receptors may also get blunted. So you have so much testosterone around that the receptors on the cells where they need to act are no longer being sensitized. And sometimes you have to take a little bit of a holiday. When I initially learned how to do hormones with creams about 10 years ago, we used to talk about taking a hormone holiday, meaning you would take your medication maybe it's day 1 through 6 and then stop on day 7. With pellets, obviously you can't do that. And so it may be a situation where you have to go off of the testosterone for a while and then resume it. Or we need to figure out what the root cause. Maybe there's something else that's going on. So one of the mistakes I think a lot of practitioners make is that I gave you a whole list of symptoms that testosterone can cause. It can cause problems with muscle mass, with bone, with mental clarity, with fatigue, energy, but there are other things that can cause that. So thyroid can be a problem. Your iron levels can be a problem. Your B vitamins, your a ton of different causes for those same symptoms. So same symptom, multiple different causes. One of the problems is that because testosterone does do all of this stuff, you may make the incorrect error in saying, oh, testosterone, let me just give you more testosterone and that will make you better. And if it's not the root cause, if that's not the reason why you're having your symptoms, it may not make you better. So it's important that you take a comprehensive approach. And then the last thing about cortisol levels are a very tricky one. Number one, because all of us are stressed, and many of us were never trained on how to manage our stress. Certain supplements can also be very beneficial. Also, behavior changes, meditation, deep breathing, walking, exercise, all of these things. But then there are also some supplements that may be supportive for your cortisol levels and your stress levels that will also affect your overall health. Yes, I don't think that prescribing hormones is easy. I do think that it requires a skill. I do think it requires an understanding of how the body works. And I'm happy that I have my medical training to support all of my knowledge with the added training of hormones. But I don't think that every provider who provides care understands all of the complexities. And so it's easy to mess up. Thank you guys for showing up.